When it comes across to medical conditions, it can range from mild to severe, from being the bird flu to being a epidural abscess. In today's video, we're going to be covering everything you need to know about an epidural abscess, everything you need to look out for, all the symptoms, the cost of the surgery, and much more. So make sure to stay tuned, like this video, subscribe, and comment, favorite, share for more videos like this. Without further ado, let's get into this video and stay researching.
What you gonna do? Where you at? Who you with? You ain't really about this. Don't talk about it. Really on the move, on the map, never slip. Keep your hands to your lips.
Alright, so now we're going to be talking about what an epidural abscess is. So, an epidural abscess refers to a collection of pus and infection material located in the epidural space, superficial to the dural mater, which surrounds the central nervous system. So, the central nervous system, this is what surrounds it. So, and if anything were to happen to it, it would mainly be affected because it's around the central nervous system. That's why if you have this and it's really bad, you may go completely paralyzed because it's right there by the nervous system. And if that pus were to get there, that would affect the nervous system, which does create automatic symptoms that alone by itself. So right there, that alone can cause that. I mean, you will have other symptoms too, but again, due to its location adjacent to brain or spinal cord, epidural abscesses have the potential to cause weakness, pain, and paralysis. So the potential does not automatically mean it could cause it. That's what makes it shocking, is the fact that you think that if you have an abscess near a place that's a very important part of the body that does indeed make us be able to control our bodies and our movements, you'd kind of think that that wouldn't do much of anything, but that's not true. You could have symptoms you may not have, which could be the bad part, because not having any symptoms at all could really cause significant amount of damage to any part of any person's body. So not having that can really do some damage, and that's 100% for sure. But like it says, it causes weakness, pain, and paralysis. So that is another thing to mention, is the fact that it's a very dangerous um, condition if you don't get enough treatment for it quick enough. So some common symptoms of a spinal abdominal abscess include back pain. This is often the first symptom because, again, your spine is located near the back. So getting back pain is the most obvious sign that you might have something wrong with you. Now, that doesn't automatically mean there's something wrong with you with back pain. One of the ways you can know is if you have severe back pain, you cannot walk, you can't even pee without back pain. And on top of that, I want to know about peeing, because again, that's part of your kidney, and this isn't a kidney, but having back pain with a fever, that's another big one. Having a fever with this, like it says on the bottom right here, fever. So yeah. So this is often the first symptom of a spinal abdominal abscess and may be severe. The pain may be consistent or intermediate, and may be worse with it when lying down. Fever. Many people with a spinal abdominal abscess develop a fever as a result of the infection. So if the abscess were to rupture, just have an abscess in general, it can cause an infection, and usually the infection would occur after the rupture of the abscess. You can have an abscess without it rupturing. Yes, that's already dangerous enough, so you can already tell how bad a ruptured of these can be. So, or it can form in the lumbar spine. Epidural abscess results in a pocket of pus. Now, a pus contains a lot of bacteria, and in that pus, it's like a big like cyst or an abscess. And the abscess contains pus, and that pus is not normal. That pus has bacteria in it that's very harmful to the body. Let alone it's already killing you or killing your body just having it unruptured. And then if you have that pus, some of it even leak out into your nervous system, into your bloodstream. That can cause an override reaction known as sepsis, meningitis, encephalitis, or in this case, a epidural abscess. Yeah, exactly, epidural abscess. So here we go. So the builds up and causes swelling. It can press against your bones and the membranes that protect your spinal cord and your brain, the meninges, which is the main part of your brain. Again, that's what protects your spinal cord and your brain. So the brain is also known as the meninges. The swelling and the underlying infection can cause sensation and physical movement. It also causes other problems. So it can affect sensation. So someone says, "Hey, can you feel this? Can you feel that?" That's to test your reflexes and to test if you can feel it. They usually do that, like tap on your body, try to test to see your reflexes, and they tend to do that after an emergency, which could be like if they do that after a surgery that has to do with the spine, or a surgery that could affect nervous system functions and sensation functions. They usually will do that, and before surgery they'll do that in case you feel funny. They'll do that and see exactly what's wrong with you. So them doing that on your knee, can you feel that? If you say no, then there most likely is something wrong with your uh, spine. So again, that can also happen if you wake up over a coma. That it could take a while for all your body functions to come back to the way it was before the coma. So yeah, so it can also cause other problems. Typically, an epidural abscess is caused by a Staphylococcus aureus bacterial infection. It can also result from a fungus or other germs circulating in your body. Most of the time, healthcare providers can't find the exact cause of the infection. So, not being able to find the exact same cause of the infection can be quite devastating and quite very frustrating because, again, if someone thinks they have their answer, they could give you medication that doesn't automatically work for it because that's not what you need. You need the actual right medication. And with stuff like this, like conditions that are hard to diagnose somebody with because it's hard to see what's wrong with them, it's kind of difficult and it can lead to a worsened condition because you're not giving them the care that they need. It's not the doctor's fault. I'm not blaming them. I'm just never would blame the doctors. I'm not kidding. I'm not blaming the doctors. I'm just saying it can be very frustrating to see what's wrong with somebody at what exact time. So, much of the time, healthcare providers cannot find the exact cause of the infection. So, the infection could be caused by many things. For one, that could be why they can't find it, or another, it's just that it's inconclusive, which means there's not enough information or test results to find the exact cause as the overall thing itself has too many reasons that could be caused by. So it's hard to see which one it is. Because sometimes any spinal infection may share the same symptoms, therefore, it could be kind of hard to find which one it is and which one it's not. Moving on, you're likely to develop an epidural abscess on your spine if you suffer from lasting sinus or ear infections, had an injury to your head. You're more likely to develop an epidural abscess if you're on your spine if you have a infection in the bones of your spine, have an infection in your blood known as septicemia, or a blood poisoning also known as sepsis, and had surgery on your back. So there's many places you can that a bloodstream infection can go to. There's spine, brain, bloodstream, kidneys, liver, much more. All these infections can spread to every organ of the body. The symptoms of an epidural abscess depend on the location of the abscess. An epidural abscess may cause these symptoms: headache, disturbed consciousness, fever, unusual sensation throughout your body. So, like a pricking feeling or a pain, like a tingling feeling, pain with coordination and movement, trouble walking, general weakness of the muscles in both arms and legs that gets worse, being unable to move your legs or arms, paralysis, which means you're completely frozen and you can't even help it. So it's not like you're scared. You're literally frozen. Like you cannot move at all. Pain in your neck or back, inability to control your bowels or bladder, feeling nauseated or vomiting, and feeling very tired and sluggish. A healthcare provider will ask about your medical history and symptoms. You may need a nervous system exam to look for changes in motor and sensory function, vision coordination and balance, mental status and mood or behavior, an MRI scan, a CT scan, test of a fluid sample from the abscessed area to find the cause of the germ, blood test to look for germs and other signs of infection. We'll see which. So, like, a nervous system exam is to like check, like, probably like those, like, can you feel this? Can you feel that? And like testers see like how good your sensory skills are and how well your vision is, because your spinal cord can actually affect your vision. Coordination, because with your spine it kind of helps you balance a little bit. So without your spine or having problems with that, that can cause a domino effect in your body. So it can cause many things wrong with you that you wouldn't think would happen with a spinal infection or a condition. How is an epidural abscess treated? Typically, your health provider will give you antibiotics to fight the infection that caused the abscess. A surgeon may need to drain the fluid from the abscess with a needle to help relieve the pressure. Sometimes your surgeon may remove it entirely. You will most likely need surgery to drain or remove the abscess if you have trouble moving or can't move at all, which would be known as paralysis. Sensation problems such as numbness somewhere in your body. What are possible complications of an epidural abscess? Without treatment, serious complications can occur, such as meningitis, an infection of your meninges, abscess of your spinal cord itself, infection inside your spine or skull bones, long-term back pain, irreversible damage to your brain or nervous system, including paralysis. Now here's the thing you want to know. Once damage to your nervous system has occurred, it can be hard to restore normal nervous system functions. Well, normal nervous system function. An untreated epidural abscess can be very dangerous. It may result in death. So if you don't get treatment immediately, you will be paralyzed, paralyzed, paralyzed forever or as long as you live, okay, which is forever. So, well, I'm not forever. You get like forever is in the terms of as long as you live. So, yeah, you could be paralyzed if you don't get treatment for this, and it could be you can never be back to the normal once you get this. That's how serious and dangerous and cautious this is. That you need to look out for symptoms like these, as it is mainly going to be caused by stuff like this, and is very dangerous. So, key points about epidural abscess. These are some key points you want to take in note of. An epidural abscess is an infection inside your skull or near your spine. It needs treatment right away. Symptoms can include headache, fever, vomiting, weakness, trouble moving or walking, and a loss of bladder or bowel control. You may also you may also have changes in consciousness and sensation. Treatment is with strong antibiotics. Surgery may be needed to drain the fluid from your abscess or to remove it completely. So yeah, and one thing you want to keep, like we talked about, like at the beginning, is Staphylococcus aureus bacterial infections. This is something you want to take a note of, as this is one of those things that can cause many blood infections, many blood poisonings, and this is very well known to cause all of those that I just discussed and just said. This is well known to cause a lot of conditions, mainly because of how smart and how resistant this can possibly be. There's a resistant Staphylococcus aureus. Can I think there's a one that's like resistant to many biotics. So like even with treatment, this could get worse. So yeah, there's some of these that are like very, 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 very smart, very, very strong, and very hard to put out. Okay, I'm not kidding you. This is a very, 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 very dangerous thing you don't want to mess with. Staphylococcus, again, it can cause many things. It's one of those it's actually the main reason why sepsis occurs. This right here is why sepsis occurs. Mainly 90% of the time, you'll see the reason behind the sepsis would be known as a strain known as the Staphylococcus aureus bacterial infection. You will mainly see this. There's a case about this boy, okay, young boy, years ago. He died from an infection that was caused by a staphylococcus. He broke his ankle, broke his leg from playing bike. I don't know if it was dirt bike or something like that. Couple days later, after he broke his leg, he died from sepsis, or from actually died from a flesh-eating thing we talked about on the channel, but it got removed from on YouTube, which I absolutely see why. It was very disgusting, but it was very informative to see what it looks like. It's actually very well known as the one and only infection that you could possibly get with this. It's known as, what is it called again? Necrotizing vasculitis. And I think this right here is one of the reasons that can occur. This is a strain that can cause. It's already an infection, right? It's an infection. It can cause bacterial infections and much more. But this can lead into a flesh-eating disease as well. And I'm pretty sure that's what he died from. If not, I apologize. This is the leading cause of skin and soft tissue infections such as abscesses, boils, however you pronounce whatever that is, it's cellulitis. Although most staph infections are not serious, SRS can cause serious infections such as bloodstream infections, pneumonia, or bone and joint infections. In some cases, treatment may include only antibiotics. Antibiotics will be given typically 4 to 6 weeks. If the abscess is placing pressure on the spinal cord, the surgeon will perform surgical decompression of the spinal cord to reduce and remove the pressure. Now we're going to talk about the price, like I said about the surgery. The average cost, for example, of spinal decompression surgery in the United States is $23,500 to get a surgery of this. The procedure is more commonly done on an outpatient basis, but can also be performed at a hospital or clinic as an inpatient procedure. So somehow you get this done outpatiently. I don't know how that exactly works, if that's safe, if that's legal, but I guess it is if that's what it says. There's a risk of developing a blood clot after lumbar decompression surgery, particularly in your leg. This is known as deep vein thrombosis (DVT). DVT can cause pain and swelling in your leg. In rare cases, may lead to a serious problem called a pulmonary embolism, which is part of your heart, like a blood clot enters your heart and something like that. So, the results of a lumbar decompression vary case by case. Many factors influence the outcome, including the condition a person has, how severe it is, and the specific procedure. Lymphadenectomy has success rate of around 90% with patient satisfaction of over 75%, according to a 2023 research article. So we're talking about DVT now. So deep vein thrombosis. DVT occurs when a blood clot thrombosis thrombus forms in one or more of the deep veins in the body, usually in the leg. Deep vein thrombosis can cause leg pain or swelling. Sometimes there are no noticeable symptoms, which is the really dangerous part because with these things, you want to make sure you're going to treat it right, get the treatment you need as fast as you can get it because of how dangerous it could be for the outcomes. But with this, there's even a chance that no symptoms will come out at all. Would you think with this you'd at least get one symptom, but that's not always the case. I'm not saying that. Oh no, okay? I'm not saying that that's not all. That's like always the case. You're not gonna get symptoms, but that's sometimes that you don't get any symptoms with this. So could be dangerous for many people. A blood clot in a leg vein may cause pain, warmth, and tenderness in the affected area. That's one way you can know. You could get deep vein thrombosis if you have certain medical conditions that affect the blood clots. A blood clot in the legs can also develop if you don't move for a long time. For example, you may not move a lot when traveling to a long distance or when you're on a bed rest due to surgery, an illness, or an accident. Deep vein thrombosis can be serious because blood clots in the vein can break loose. The clots then could travel through the bloodstream and get stuck in the lungs, blocking blood flow. Pulmonary embolism. When DVT and pulmonary embolism occur together, it's called venous thromboembolism. Deep vein thrombosis symptoms can include leg swelling, leg pain, cramping, soreness that often starts in the calf, change in skin color or on the leg, such as red or purple, depending on the color of your skin. A feeling of warmth on the affected leg. Deep vein thrombosis can occur without noticeable symptoms. When to see a doctor. If you develop symptoms of DVT, contact your healthcare provider. If you develop symptoms of a pulmonary embolism, a life threatening condition of deep vein thrombosis, seek emergency medical help. The warning signs and symptoms of a pulmonary embolism include shortness of breath, chest pain or discomfort that worsens when you take a deep breath or when you cough, feeling lightheaded or dizzy, fainting, rapid pulse, rapid breathing, cough up blood. A pulmonary embolism (PE) occurs when a blood clot gets stuck in the artery and the lung blocking blood flow to a part of the lung. Blood clot most often start in the legs and travel up to the right side of the heart and into the lungs. This is called deep vein thrombosis. So remember guys to like, subscribe, comment, favorite, share. I hope you guys learned something new in this video. Just so you know, yes, this stuff can be very dangerous, including with the Staphylococcus aureus when it can cause a deep vein thrombosis and much more. So I hope you guys learned something new, and remember, stay researching.